here in Johannesburg, the Charlotte Maxeke Hospital was also affected by the Nehawu strike today. The entrances were blocked off. The main entrance, at least, was affected. Ahmed Kaji is our reporter on this story. Let's go live to him now. Ahmed, are patients and staff now able to go in and out of that hospital?
Thanks very much, Mzikayise. The roads entering the Charlotte Maxeke Hospital have been reopened. About 15 minutes ago, the roads which were blocked by those rocks were removed from the road by law enforcement as well. And many of the Nehawu members have left. We do understand they probably will be returning tomorrow to carry on this strike. And I think now would actually be a good time to find out exactly what is going to be taking place tomorrow, especially following these delays and disruptions to the healthcare sector across the country. Many of those hospitals are not getting adequate services. Many patients are not receiving any healthcare whatsoever at certain hospitals. But we can now bring in the Provincial Secretary for Nehawu, Mzikayise Tshontshi, into the conversation. Mzi, thanks very much for your time today. We have seen disruptions throughout the course of today. What can we expect tomorrow?
Greetings to you and your viewers. The most important thing for us tomorrow that you must expect is that we are intensifying our action. We are not expecting disruptions in health services, but our members, of course, will exercise their right to strike as prescribed by the Constitution of the Republic. And in this particular instance, I can tell you without a shadow of a doubt that tomorrow we'll be continuing what we have been doing all along. But there's no way that we are going to negatively impact the communities that we serve. The most important thing for us is to make sure that our strike does not affect communities negatively, but our strike must serve to tell the government that enough is enough.
We were at the Kopanang Hospital earlier today where no doctors or nurses were in the hospital. It was just executive management carrying out the limited operations that they could have. Has this been the case at the Charlotte Maxeke Hospital today as well, or are some of the doctors and nurses still working there?
From our understanding at Charlotte Maxeke Hospital, there were discussions between the union and the management, which led to the union agreeing to providing minimum services as the law requires them to do. And in that regard, in all departments where we were asked to ask our members to go back to work to make sure that the service that is continuing, we did manage to do that successfully. And we know that any disruption that will have happened was remedied through such an intervention, and that was work between ourselves and management of the hospital and the Department of Health in Gauteng.
What then would your message be to the public? I mean, it's a discrepancy between yourself and your employer, but it seems that the public, unfortunately, is facing the consequences of this.
Our message to the public is that there's a fight between ourselves and the employer, which is the government of South Africa, the 6th administration led by Cyril Ramaphosa, and this dispute is related to collective bargaining issues between ourselves and the government. And we are not in a fight with any member of the community, and anything that happens during the strike that seems to suggest that we are fighting with the community, we correct it as a matter of agency. And from where we are standing, we have no qualm with the constituency that we serve as workers. And the community of South Africa must know one thing, that the fight that we are engaged in is a fight to defend democratic gains of 1994. We are defending the democracy that we achieved. We are fighting for the rights of the patients that we serve in hospitals, of clients that we serve in other departments. And those rights can only be served if the government is serious about providing services. For instance, one of the biggest problems in the public service, 165,000 positions that are funded are not filled by the government, and we don't know why. And that leads to queues being long in many departments, home affairs, health, you name them. And our fight, therefore, is to remedy that situation. Because when people see that there are queues that are long in hospitals, they blame nurses, they blame everybody that is in the hospital. What they never know is that the government is failing to employ enough people to perform the duties that must serve the communities. One of the reasons why we're on strike today is because we want to correct that anomaly. We want our people to receive the kind of service that they deserve. And that service can only be done by a government that cares about people. And as workers, we believe that we are humans that must be treated ngendlela fair. And currently, we are not being treated fairly. Not only about salaries, because this thing is not just about salaries. This is an attack on us as people, as human beings. This is an attack on us as workers. This is an attack on the communities that we serve. Because when you do not employ nurses, you expect that nurses must perform miracles. And nurses are unable to do that. When you don't employ porters in a hospital, you expect porters to perform miracles. The same applies to other departments, because our strike goes far beyond Charlotte Maxeke. It goes to the police. Our security situation is compromised because the government is failing to do the right thing, employ adequate police to protect the people of South Africa. Give police the adequate remuneration that they deserve as citizens of the Republic. Give teachers adequate remuneration that they deserve. Unfortunately, we have a government that does not care about those things. We have a government that has cut budgets on social spending, and that social spending that must serve the interest of the country. Unfortunately, all the money goes down the legs of the ministers. Tina, we are not eating. All these people are living beautiful lives, while the rest of society is suffering. We have increases for ministers at the same level as ordinary workers, while ministers are earning huge sums of money. But today, the salary increases of ministers are equal to salary increases of ordinary workers. A cleaner gets 3%, a minister gets 3%. And that's an anomaly that society can never allow.
Mzikayise Tshontshi, thanks very much for your time today. Indeed, Mzikayise, just the insight from Nehawu, and I guess the big message coming out from here is that this strike will be continuing into tomorrow, and there will be that escalation. So one can at least expect at minimum tomorrow for those roads coming into Charlotte Maxeke Hospital to be closed with rocks, and probably this will be the situation at other hospitals around the country.
Ahmed Kaji outside the Charlotte Maxeke Academic Hospital.